Hi, this is Kristen. I'm the owner of Focus Healthy XRX, and today's topic is exercise and arthritis, something that over 48 million people in the United States deal with, and I would have to say that number is probably low. A lot of us who feel aches and pains in our joints don't necessarily get diagnosed. It's something that most of us will feel as we age due to either, past athletics that we did or, repetitive stress during our occupations or even past injuries can cause wear and tear on the joints and our joints to break down a little bit quicker than we would like. So, our first instinct when we're feeling a lot of chronic pain, especially, is to rest. Rest is good. Too much rest for arthritis is not good. So research has shown us that regular exercise, the proper exercise for your body, can decrease your pain up to 40% overall. It's a little counterintuitive of what you want to do when you're feeling pain, but regular exercise is really, really important. First, it decreases the inflammation in your body, both systemically and in your joints. Second, it will lubricate the joint cartilage and reduce stiffness that you may get. And thirdly, it will strengthen the muscles around the joints, which will take pressure off the ligaments and off the issues in that area. The strong muscles will kind of take over. So that's really, really important. 5 things to think about when you do exercise in order to be successful at relieving some of the pain overall. First, pick a good activity that's good for your body. If you have really bad arthritis in your knees or ankles, I would not suggest a high impact activity such as running. You're going to end up, degrading those joints much more quickly, and that's not something you want to do. So you want to preserve your joints. So you want to pick low impact activities. You want to, think about swimming, biking, Pilates, yoga. You want to lift weights, but not extremely heavy. You don't want to go towards max. And do a lot of stretching as well. So you want to pick the right activity for your body. Second is you do want to be consistent. You want to rest, but you want to make sure that you don't leave more than 48 hours in between a workout. All right. This way you're going to get the maximum benefit from the exercise. The third thing is vary your activities. So don't just do biking, don't just do swimming. You want to do maybe 1 or 2 days of one activity, 1 or 2 days of another activity. The more that you change things around, the less impact it will have on specific joints, and it will, let your whole body be impacted, especially the joints that are still healthy. Another thing is to hydrate, and this goes back to the joint lubrication. So make sure you're constantly drinking water and hydrating your body. And another thing is to make sure that you have proper footwear and proper equipment. I always tell people, if you're going to invest in anything, invest in a good pair of sneakers. This will affect your back. It will affect your knees, your ankles, your legs, your hips, everything. You don't need $100 pairs of sneakers. Most of the time, those $100 pair of sneakers, in 1 year or 2 years, those are $40 on the same websites in the sales section. So you can always find very, very good sneakers. It's good to change your sneakers every 3 to 9 months, depending on how, active you are. But, frequency is better than getting a very expensive pair of sneakers and having them last for 3 years. It's better to be more consistent, get something a little less expensive. So in the end, exercise when you have arthritis. It is definitely counterintuitive sometimes, but, you know, listen to your body, give yourself also some rest, but not too much rest. And if you have any other questions, you need more personalized guidance, please feel free to drop me a line and I can definitely help you. Thanks.